If you identify yourself as an emotional eater, or are you concerned about someone you care about who tends to turn to food too much, if you've answered yes to either of those questions, you're in the right place. I'm Dr. Jeannie Sykes, clinical nutritionist at Cone Health Family Medicine, and I'm going to talk with you today about dealing with emotional eating. Amazingly, we make about 200 food decisions every day. Not just what we eat, but when we eat, with whom, how we eat, how much we eat, and lots of factors go into those decisions. It might be nutrition concerns, social influences, it might be cost or convenience, how hungry we are, and also emotions are often a part of that equation. Emotional eating is sometimes defined as eating in response to negative emotions. I would argue that it could also include eating in response to positive emotions, although this is probably a little more accurately categorized as mindless eating or social eating. There are distinct differences between eating from emotions and eating out of physical hunger. First of all, when we're eating emotionally, that's a hunger that tends to have a sudden onset. And it tends to be a very specific food that we're looking for, or type of food cravings, in other words. There tends to be a need for instant satisfaction. With emotional eating, we tend to keep eating even after feeling full. And lastly, there's usually guilt feeling after finishing eating, regretting the food choices that have been made. With physical hunger, when we're eating in response to physical hunger, it's just the opposite of all those things. It tends to be a gradual onset of hunger. There are lots of ways of satisfying a physical hunger. Hunger can wait if we're eating in response to physical hunger. And then when we're eating in response to physical hunger, we tend to stop when we're full. And if you sit down to a meal or a snack feeling physically hungry and you finish eating, you tend to feel good. You feel satisfied, not guilty or feeling bad about what you just ate. Food cravings can be very intense, sometimes linked to very strong emotions related to clinical depression or from anxiety or frank eating disorder. And in these situations, it's best to seek some professional help, such as a therapist at Cone Health Behavioral Health, for example, or a registered dietitian at Cone Health. Usually overeating, or that lack of control that is felt, is much more related to the restricting or the denial of pleasure from food that happens before that eating episode, rather than from enjoying the food too much. It's just not appreciated by most people that we have to get some pleasure from our food in order to have optimal appetite control. This doesn't mean necessarily eating just whatever strikes us as most appealing at any moment. There is what I call the 3 questions of a good food decision that I think really helps people make the best food decisions for them. Those questions are, number 1, how hungry am I? Number 2, what am I in the mood for? And number 3, what's good for me? You might, for example, wander into the kitchen some evening and thinking about a snack, also thinking, well, I've been trying to lose a few pounds, or I'm just trying to eat a little more healthfully, so maybe I'll have carrots. Carrots would be a healthy snack. Well, if you're like me, carrots are probably just not going to totally cut it. But I might be thinking, what's good for me? And only ask that one question and settle for the carrots. Chances are, if that happens, I'll be back in the kitchen. And this time I might be reaching for a piece of fruit. That might be followed by, say, a yogurt. And then that might ultimately be followed by that leftover birthday cake that really was in the back of my mind all along. So if we ask only that one decision, although it seems like a good question, what's good for me, we're not going to get the best food decision that brings the most satisfaction. And in the meantime, we've eaten our way through the kitchen until we come at that food we really wanted. If you choose to have something sweet, for example, you get the most satisfaction out of the highest quality item. One chocolate brownie, or say a nice muffin from a local bakery, is going to give you more satisfaction than a whole container of prepackaged cookies. The 3 questions process is obviously not for every food decision we make, but it is appropriate when you're struggling with a food decision, or you're reaching for the chips, or grabbing some cookies, or you know you're eating for the wrong reasons. Asking these 3 questions forces a conscious choice and mindfulness. And mindful choosing, followed by mindful eating, gives us the most physical and psychological satisfaction. And this means the best appetite control. Another mistake that people make in trying to manage appetite is skipping meals or simply not eating enough. I tell my patients to eat within the first hour of getting up, and then to eat subsequent meals and snacks throughout the day at regular intervals, never going more than 5 hours between eating. And that's going to help with the best appetite control and getting away from that psychological deprivation that we feel when we skip meals. So, to gain the best control over our appetite, we need to eat at regular intervals during the day, and we need to make sure that we're getting satisfaction from our food, not denying ourselves that pleasure. Thank you for joining me today, and I hope that I've helped you to gain a greater sense of control over your appetite. For more information, you can go to conehealth.com/healthy eating. Thanks.